We've really been focusing on moving from that or shifting from that consciousness around the medical mental health system and moving toward also a more social-oriented mental health system as well. So we're doing something now and moving more towards something called social prescribing. So, we use that language, prescription, with, medical services often, but why not use it for social services too? So it's a concept where healthcare providers are now socially prescribing community services and non-clinical services that are local to folks, in order to promote their mental health and their well-being. And a social prescription can look like anything. It can look like taking a dance or art class. It can look like going to yoga, joining a hiking group and being among your community. So that's a piece of how, at NL Health Services, we are trying to really encourage that rebuilding of connection and community through those social prescriptions. And another cool thing about social prescriptions is also that, it's not just about getting people to do use community services and learn what's around them and network and connect. It's also about how do we remove barriers for people to actually connect with those social types of services. So how do we create health equity? So when I'm saying equity, what I mean is not just equality. So if we had three different folks, a tall, a medium, and a short person, and we gave them all blocks to stand on, they would still be unequal, right?
Sure.
So it's about not giving a box to the tallest, one box to the medium, and two for the shortest.
Right, it's
so
not a one-size-fits-all kind of solution.
Right, absolutely.
Meeting people where they're at. It sparked, I got to jump in here because it sparked a memory when I watched Mike Wall's great new show. There was a bunch of people who were having some hard times, some challenges in life, and they joined a surfing club. And these are very macho guys, teenagers, young adults. Perhaps if it was called a mental health reach out for help, they wouldn't have done it. If it's if it's on the surface level a surfing club, underlying there's some mental health issues and you can talk to a therapist, there's still some kind of stigma when it comes to reaching out and getting clinical help. But anyway, I love the idea too of preventative. We don't have to wait till there's a mental health crisis. We can do things in our life to keep our mental health well and adjusted and at bay before there's a crisis.
Absolutely. So that's a big part of the team that I work on. So my role is the mental health promotion consultant for the Eastern Zone, urban and rural. And we have consultants and coordinators on prevention and promotion teams right across Newfoundland and Labrador. And that's the focus, is to promote mental health and wellness and prevent addiction before it occurs. So before we get to that crisis point, and creating a system that's less reactive and more preventative and proactive.